Most of us know the drill by now. Feeling sick? Get a COVID test. It's typically a quick swab of the nose and free.
It's very odd.
But when Dustin Timbrook wasn't feeling well, he says his COVID test was anything but typical.
I thought it was odd. Why are we treating this like a normal doctor's visit?
Gwinnett Urgent Care and Family Practice advertises free COVID testing with insurance. What this sign doesn't say is you have to see the doctor. Timbrook says he was weighed, had his blood pressure taken, and finally...
I took a nasal swab. I thought it was I assumed it was a COVID test.
It turns out Timbrook got much more than he asked for.
There are at least 40 things on here that are not COVID.
Tests for influenza, rhinovirus, pneumonia, whooping cough, the measles, mumps, and much more, all with a price tag of nearly $1,200.
Which is crazy. I went in for a COVID test. At least 800 of that was not covered by my insurance.
So you're on the hook for $800?
Yeah.
We took a closer look at the clinic and found Timbrook wasn't the only one with this complaint. Google reviews show similar stories of being required to see the doctor and paying $125 even with insurance.
Early on in the Biden administration, they clarified that when someone goes to specifically get a COVID-19 test, the associated costs of that are also required to be covered by the insurer.
You are not supposed to pay anything out of pocket unless you're asking for urgent service.
Dr. Guy Bai of Johns Hopkins and Krutika Amin from the Kaiser Family Foundation are both experts on the CARES Act and say by law, people with insurance do not have to pay for COVID-19 tests.
So are we seeing places charge people for COVID-19 testing who should not be charging them?
Yeah, that actually is illegal. And we have seen many disputes.
We decided to see for ourselves how Gwinnett Urgent Care and Family Practice is handling COVID testing.
So if I'm going to a clinic, a healthcare clinic, and I have insurance, I should be able to walk in there and get a COVID test and not have to pay any money.
That is correct.
But that's not what happened.
I have to pay $125, but I thought it was free COVID testing with insurance.
We took this audio recording of our visit. The receptionist tells me I can't just get a COVID test. I have to see the doctor.
I'm sorry, what am I seeing the doctor for?
Because it's an office visit.
Because it's an office visit? So I can't just do a COVID test?
No, ma'am.
We left and then called the facility, asking to speak with someone on camera about its COVID-19 testing policy and charges. Over the phone, the CEO said he pays the doctor $120 an hour, so he can't just give free COVID-19 tests. We asked if he thought his sign outside boasting free COVID-19 testing with insurance was misleading. His answer, no. He declined an on-camera interview, and the facility gave us this statement. Gwinnett Urgent Care and Family Practice is committed to maintaining compliance with all applicable federal and state requirements as to COVID diagnostics, treatment, and vaccination.
To me, it seems like a very deceptive practice that you are clearly advertising COVID tests and then you're bringing people in and signing them up for what they did not sign up for.
Timbrook says he's going to fight the charges with his insurer and hopes in the meantime he can prevent others from going in for a free COVID-19 test and leaving with a bill.
The Centers for Medicare and Medicaid Service also weighed in on this story. It tells me the government requires free COVID testing. However, it does not regulate whether a clinic requires a medical visit for that testing and what it charges for that visit. After all that testing for Timbrook, the only thing that came back positive for him was rhinovirus. He had a cold.